May is Mental Health Awareness Month, and people with ADHD often face unique struggles that can contribute to the development of mental health conditions. And joining us now is board-certified psychiatrist Dr. Craig Chepke to discuss why it's important to shine a spotlight on ADHD and its relation to mental wellness. Good morning, Dr. Chepke. How are you?
Good morning. I'm doing very well, thanks.
Good. So what kind of impacts can this have on a person's life?
Well, as you mentioned, that ADHD can contribute to other mental health conditions like depression, anxiety. 80% of people with ADHD are likely to have one of those other ones. But also just to reinforce that ADHD is a mental health condition in and of itself. There's a significant amount of stigma associated with ADHD, and there is with all mental health conditions, but I think ADHD even more so than the others. So I just want to make everyone aware that ADHD is a brain condition like all those others, depression, anxiety, and we shouldn't look at it any less than physical conditions like type 2 diabetes, high blood pressure, etc. It's something that is not someone's fault.
You mentioned the word stigmas there. So what are some of the stigmas a person with ADHD may face in their daily life?
Great question, and there's been progress over the past generation or so, but we still have a long ways to go. Corium recently did a survey of over 400 healthcare providers who treat ADHD, and they found that 100% of those healthcare providers said that it affects their patients in terms of their self-esteem and their confidence. However, 81% of those, it's moderate to severe in terms of the effect on their self-confidence, self-esteem. So it really impacts how people with ADHD see themselves and how they view their part in the rest of the world.
What is the relationship between it and other disorders?
Well, it can be a contributor to other mental health conditions, or it can be mistaken for other mental health conditions. Some people will present to, well, I'll just use myself. I often get people coming in and they believe they have been diagnosed with depression or anxiety. And it turns out when I do a very careful history and they actually have a diagnosis of ADHD and they just never knew it, and we're getting treated for it with other medications like antidepressants that aren't effective for ADHD.
You mentioned treatment there as well. So why is it important to speak with a doctor about a tailored approach when being treated?
Everyone's going to have a different response to treatment and may need different things. Could be psychotherapy, could be ADHD coaching, and medication is an important part for some people with ADHD. There's many different options for treating ADHD, and one that's worked well for many of my patients is called Azstarys. It's approved for everyone ages 6 years up and older, and it's the first and only ADHD treatment that combines two different forms of medication in one capsule. It takes effect quickly early in the day and is able to control symptoms throughout the day and then wears off gradually into the evening. Just so everyone's aware, CNS stimulants like Azstarys have a boxed warning, and that's to have a high potential for abuse, misuse, and addiction. People who take Azstarys should be monitored for serious cardiovascular or circulatory side effects, tics, and slowing of growth in children. Azstarys may cause or worsen certain psychiatric symptoms, so it's important to talk to your own healthcare provider about all the potential risks and benefits.
What are some topics that people should discuss with a doctor when receiving treatment?
I would advocate for people to be really open and transparent with their healthcare provider. As we mentioned, there is such a stigma that it's my own fault, that I'm unreliable, I'm lazy, I'm flaky, things like that they may not share everything that is going on in their lives, all the different symptoms. And it's important for the healthcare provider to know everything that's going on so they can make the right diagnosis and tailor the right treatment to them.
Dr. Chepke, why do you think the diagnoses have increased in recent years?
That's a great question. I get asked that a lot. And it's not that there's suddenly an explosion of people who have it compared to in the past. It's in part because we have a greater understanding of the neurobiology of ADHD, the science has evolved, and we realize now that people don't outgrow it from childhood to adolescence to adulthood. Most people who have ADHD as a child, it will stick with them throughout their life. And we used to think that everyone grows out of it. And then with the incremental improvements in the lowering of stigma that we've seen, more people are asking about it. They're seeking out a diagnosis and seeking treatment for it. So it's not that more people have ADHD, it's just that less people are going undiagnosed with ADHD than in the past.
Dr. Chepke, this is really great and professional information for our audience. And where can they go for more information on ADHD?
For more information on ADHD and about Azstarys, people can visit www.azstarys.com. That's AZSTARYS.com.
Doctor, thank you so much for your time this morning. For more information about treating ADHD, head to azstarys.com.